Welcome back to Beyond the Clinic Walls, the podcast dedicated to helping private medical practices thrive by leveraging technology and innovation. I'm your host, Roby Flynn, and today we're exploring an inspiring model of patient-focused care that offers relief and hope through specialized non-surgical solutions for chronic foot pain. I'm very excited to introduce our guest today, Dr. Robert Kornfeld, a leading expert in non-surgical solutions for chronic foot pain, known for his work at drrobertkornfeld.com. Thank you so much for joining us.
My pleasure, Roby. Thanks for having me on.
Yeah, of course. Could you start by telling us a little bit about your practice and your mission to help patients find relief from chronic foot pain without surgery? And what was your driving force behind your specialized approach?
Okay, so my training was in foot and ankle surgery primarily, which, the typical podiatric residency does that for you. And when I got into practice, there was a couple of things that happened to me that I wasn't expecting. Number one, a lot of the things that they taught me weren't working out the way that I thought. And unfortunately, as residents, you don't get long-term follow-up to see that things don't go well at the end of the road. So I thought there had to be something more to healing my patients than just the surgical event itself. Coincidentally, my practice began to grow so incredibly fast that I couldn't handle it. I had no business training. I didn't know what I was doing. I was dealing with probably 40 to 50 patients a day back then. I was running staff, but I didn't know how to manage them. And I started getting what we now call burnout. I had symptoms of every system in my body. I was really suffering. I went to a lot of the doctors I knew from my hospital. No one was helping me. I was getting side effects from drugs. One of my friends recommended a holistic doctor. I didn't feel good about going because I didn't know what it was about. But this guy turned my life around in 3 months. So between that and looking for better ways to heal my patients, it became clear to me that everyone has issues that precede the symptoms that they go to their doctors with. And I started looking at a more holistic approach to healing my patients by understanding not what they had, but why they had it. And that means we have to look at all the systems of the body. We have to look at the epigenetics, which is diet, lifestyle, and environment. We have to look at genetic influences because many of us have mutations. Nature's always trying to figure things out. And we have family histories. We have medical histories. All of these are part of the diagnostic part of understanding why patients have what they have. And that led me into eventually learning about what's now called functional medicine. And that just opened up a whole new world of healing for me. So in functional medicine, the patient comes in, we make the diagnosis, then we have to ask why. Why does this patient have what they have? What are the influences that brought them to this point where they crossed that morbidity threshold? The immune system was incapable of healing and repairing whatever injury they had, whether it's frank injury or repetitive stress or degenerative. And once I got to that point and patients started reporting that they were feeling good, the pain started to go away, I was doing a lot less surgery. And I said, there must be ways that I could complete the healing without taking them to the OR. And that's when I learned about regenerative medicine, where we actually work with signaling the immune system to facilitate repair, but you need an efficient immune system to do that. So the marriage of functional medicine and regenerative medicine is how I treat my patients. And it does require time, concentration, effort, and I couldn't do that in the system because I had to see too many patients to survive. So in the year 2000, I crossed my fingers and I said, I'm going to try to do this without insurance, just to build value by being the best possible doctor that I can be, because I couldn't be in the system. And here I am 26 years later, and I'm 71 years old and I'm still going. I still love what I do and I'm not going to retire because I've changed thousands of lives and it just fuels me every day. It's inspiring, it's invigorating, and I just enjoy it so much. So that's kind of the short bio of how this whole thing happened.
No, I think that's great. And I know, speaking because I come from a medical background as well, patients, no one wants to get surgery. No one wants to be put under the knife. So being able to fix these problems without having to do that it's really great. So what are some of the key benefits of this approach for your patients, and why do you believe it's often an overlooked or under discussed option in conventional medicine?
Well, I think the major benefits are not only that I can heal chronic foot and ankle pain that's taken them out of the lifestyle that they crave, but in the process, we're up-leveling their health and we're giving them a blueprint to stay healthy, or at least as healthy as we possibly can make them in the environment that we're living in. Educating patients is a big part of what I do. And I teach patients when you go to the supermarket and you look at the food that's on the shelves, you can understand why so many people have chronic illness. We're eating our illnesses and then we're medicating those symptoms with pharmaceuticals. But we need more people to be more aware. I know a lot of patients say to me, well, I went to the health food store, the organic food was very expensive. Well, it is, but this is a capitalist society. It's all supply and demand. The more patients we educate, the more patients demand organic, healthy food, the lower the prices. So we can't shy away from it. We have to embrace it because it is correct. Anything you put in your body that's not natural creates an immune challenge. Now we have a misdirected immune system. It's spending so much time trying to figure out what's coming into the GI tract. All the other jobs it has have to get put on the back burner. So, redirecting the immune system to its five main jobs, which is repairing your injured cells, replacing the dead ones, detoxifying all the cells of our body, replenishing what's used up, like blood cells and hormones and enzymes and cytokines, etc., and to protect us from the pathogenic microbes that exist in our environment. A misdirected immune system can't do all of those things. And we wind up with chronic illness, chronic infection, and then it leads to other things. When we add that to the stresses of modern living and the way people deal with their evening routines, where they're on computers and TVs and phones before they go to bed, they have disturbed sleep. Sleep is where we regenerate, replenish, repair. So all of this comes in the educational part of how I handle my patients' problems, and you need time. You need a lot of time. So that's the main benefit. Ongoing, when I'm dealing with my patients, I found that I needed a lot more time to discuss things with them and follow up. So I'm not recommending this to every doctor, but it worked great for me. In 2014, I fired my staff. Now it's a one-on-one relationship between my patients and myself. Nobody answers their question incorrectly. Nobody gets a phone call and forgets to tell me. And I'm not overwhelmed with a high volume of patients anymore. So I have plenty of time to answer patients. And the more contact they have with me, the more they learn. The more they learn, the more they comply. And outcome obviously depends on compliance and follow-up. So it's been a great formula for me. And this is why I founded the Institute for Functional Podiatric Medicine in 2023 to teach this to my podiatric colleagues. And of course, this is my way of giving back because I found my way through all of the muck and mire of insurance dependency. And now I know 26 years later, I've been out of it for so long, but when I hear the stories of what's going on and how the independent practice is almost extinct because everybody needs to be employed to have a consistent income or a reliable income, but it's just not sustainable anymore. There's just too many burdens on doctors and they're suffering. And if doctors are suffering, their patients do as well.
I like your take on the food. It was very interesting because, organic food is very overpriced, at least in terms of today. And it's almost like you have to buy your health back, and it shouldn't be like that. I actually saw, it's pretty interesting since the World Cup's going on right now. One of the teams from over in Europe shipped over a bunch of their own food here because they're like, we're not going to eat America's food. What
I
is
know. Well, one of my sons is gluten sensitive. He gets sick every time he eats it. And I was with my children in France 3 years ago, and he decided to experiment. His dad, I'm going to eat gluten in France and see if I get sick. I said, why would you do that? We're on vacation. He goes, because someone told me it's different.
Yeah,
And he did not get any sensitivity reactions.
I heard that. Yeah, it almost makes you wonder: is it the pesticides they're spraying on all this stuff? Well, what the heck is in it? So I'm
Right.
glad he did
Well,
not
we
have
don't
that
know.
vacation.
We don't know. The FDA has approved a lot of things to keep food on the shelves longer, but it's not necessarily health promoting. And that's the only reason we eat, right? Is to keep our health optimal. It's our fuel. And if we're putting in bad fuel, the car's going to conk out, right?
Exactly. Yeah. So your practice is highly specialized. How does this deep specialization allow you to provide superior patient care and outcomes compared to a more general practice treating foot pain?
Well, I did give up the majority of what is typically involved in a podiatry practice. My practice is chronic foot and ankle pain. It is a niche, but here's why it's worked for me. In the system, because doctors are forced into high volume and they don't have time to look at underlying mechanisms, everything is quick fix medicine. Cortisone injections, nonsteroidal anti-inflammatory drugs, analgesics, Medrol dose packs, and maybe some physical therapy. There's a huge population and it's growing very rapidly of patients with chronic foot and ankle pain that are not getting healed. So they have to look outside the system because they've already been to 5 or 10 doctors and they're not better. Many doctors now are adding regenerative medicine into their protocols, I think primarily because it's a cash pay service. But if they're using it on a patient with an inefficient, burdened immune system, they're not going to get the results they're looking for. So while I applaud the fact that they're embracing some more natural healing, they need time to prepare the patient, to optimize the patient for healing. And that's why my practice has been able to thrive for 26 years. It's not just foot and ankle pain. There's chronic illness is on the rise. All of the different things that different specialties manage, every practice has their very difficult patients that they don't know what to do with. And functional medicine addresses these patients in a much more comprehensive way. So I think if we can look at the future of medicine, it has to include functional medicine. It has to include regenerative medicine. I'm not discounting the beauty of traditional medicine. We have a lot of wonderful things that we can do, but we have to marry the two of them so that we have the best, most comprehensive way to approach patients. And I think that should be the future of medicine. What stands in the way are insurance companies. They don't like natural medicine. They don't want anything that requires lots of time, many visits, because they're looking at it from a financial algorithm, not true healing, not true healthcare. So I don't know the solution to that problem. I do know once you leave the system, insurance companies are no longer able to dictate what you're doing, and you can help your patients in the way that you deem fit. And every patient is unique. Every patient with the same diagnosis does not get the same treatment in my office because everybody's addressed in their own unique, specific dynamics. So, the diagnostic part of it is critically important to find out why each patient has what they have, what forced the immune system to stop trying to heal and go into that state of repair, protection. And that protective pathway, which we call chronic inflammation, is the pathway that causes pain. It ultimately leads to degenerative problems, arthritis and vascular disease and all of those things. So, to put a stopgap on that is critically important.
That's great.
Or we're going to continue to see rising medical costs that are going to bankrupt the system.
Yeah. And especially, touching on the food point again, more and more chronic illnesses happening. It's just going to ultimately inflate insurance prices even more to the point where people can't even afford it. And then they're not even going to be seeking medical care. And it's just, it's just a system that's failing itself.
Well, as a doctor who has his patients journal their diets, it is horrifying how the majority of America is eating. It's horrifying. And it's no surprise that they're suffering with comorbidities. I mean, I don't get patients just with chronic foot and ankle pain. They have many other issues that they're dealing with. It's a total collapse of the immune system. You can't keep feeding it garbage, and expect that your body's going to, be optimal. It can't be. It's dealing with too many things,
Yeah, and I mean, this definitely touches on probably a lot of the patients you deal with, but the amount of type 2 diabetic people that are in this country is just outrageous. And then for people who aren't medical, a lot of times diabetes causes neuropathy, the vessels aren't perfusing, it starts in the toes. First, they're not perfusing the extremities the way they should, and then people get their toes cut off, their feet, then it goes below their knee, above their knee, and then typically after that, I see them in heart failure, and then they're in the ICU, and then they're dead. So
absolutely, it's the domino effect,
Yeah.
I mean, one of the biggest subspecialties in podiatry now is wound care.
Right.
But that's downstream treatment.
Yes.
Where are we in the upstream part of their illness where we could actually intervene and prevent? That's what we don't have. And the system doesn't allow it, doesn't pay for it, doesn't want it. Let's treat the 15% of patients who have pathology that's being treated instead of avoiding it in 100% of the population, because initially it'll cost a lot more money. In the long run, it saves people from suffering, it saves money, it saves lives.
Yeah. And it's sad. I wish there was more. I look at these patients, I'm like, how do you not understand? But then I just have so much background and education in it. I know the things to avoid and what to eat and what not to eat and working out. But unfortunately, these poor people don't. They're told, go spend $5 at McDonald's and you'll be fed for half the day rather than spending $10 for food and veggies and organic meats. So
right. And we're also a society that tremendously overeats.
Yes.
There's no reason for the volume of food that people are packing into their bodies, and all you have to do is take a walk in the streets in any city of America, and you'll see the great majority of people are overweight. That's a problem, That's a metabolic stress every single day.
So a significant part of your work, as you mentioned, involves educating your patients and their options. How do you advocate for your patients, ensuring they're fully informed and empowered to make the best treatment decisions for their health?
There's two ways that I do that. Number one, because I'm not in a rush, I've learned to sit and listen. And when patients actually have the time to explain the history of what's going on, there's a lot of clues that are picked up in that process that give me information to move forward. But the most important thing is time. I have created a practice that's low volume, high value. I have a lot of time to sit and talk to my patients and educate them and email them. All of my new patients get a complete summary of our first visit with everything we spoke about, all of my findings. I try to put it in lay terms so they completely understand. And at the end of my letter, it invites them to ask me questions. And most do. Once patients have the ability to hear and understand and learn, they want to know more.
Right.
And that's the right every single human being has to be well educated. There's a difference between educating a patient and giving them what we call informed consent. Informed consent is this is what I'm recommending. These are the possible downsides. That to me is not education. That's preparation. But education is bringing them up to speed on exactly what's going on in their body and why they are dealing with it and what they can do. And I have to empower them to do it. People have habits. Old habits die hard. The human brain is very lazy. It likes to do what it's used to doing. You have to reprogram it, and you have to do it in baby steps. If you say to someone, and this happens all the time in medical offices, you're overweight, go home and lose weight. That doesn't mean anything to anybody, and they're not going to do it. But if you start working on things little by little, so it's not overwhelming, not too challenging, and they can be successful, that's what you do. Like with a lot of my severely overweight patients, part of the protocol is you've got to start moving. So either you go to a health club or you buy a stationary bike. And I say to them, I want you to get on that bike with a stopwatch. Ride it 1 minute a day for a week. Why? Because they'll be successful. Then we move to 2 minutes a day the next week. Little by little, a month later, they're riding for a half hour. But if I said to them the very first time, go home and ride for a half hour, the next day they won't be able to walk. All their muscles would hurt and they'll never get back on the bike. So it's the same thing with teaching people how to eat well, how to think well, how to manage stress, how to sleep. Everything's done little by little by little so that it doesn't feel challenging. It doesn't feel overwhelming. And the brain cooperates. And when people start to feel better, now they have motivation. I'm definitely feeling better. I'm going to keep doing this. I'm going to do what Dr. Kornfeld said. And what about this? And then, they send me an email or they send me a text and they get an answer right away. So that communication part of the doctor-patient relationship is critical,
That's great.
really critical.
No, I mean, you got to give people small wins no matter what in order for them to achieve the big win, You can't just throw a daunting task in front of someone and expect them to do it. There are certain psycho people out there that probably could achieve it, but that's not how everyone's built.
Correct.
What are some of the biggest hurdles you faced in establishing your practice, and how did you overcome them?
My biggest hurdle was now I no longer had the insurance participation booklet for people to see that I existed. So to do what I do, it requires outreach and marketing. That was a big challenge for me, and I didn't know how to do it because I had no prior training in it. But little by little, I learned certain things worked, like inviting the community to my office for short lectures. I joined the Speakers Bureau and I started talking to community groups. I started writing articles in local magazines. I got a radio show, which was the smartest thing I ever did because I could talk about different issues and then invite questions and answers. So I did it once a week. It was a half-hour radio program, and I was just educating people. And I think that helped people understand that I was not the typical podiatrist, that I was doing things differently. And it definitely brought patients into the practice. In those days, we didn't have social media, so I worked to create and establish rapport with other doctors that were working in this holistic space, for cross referrals and things like that, because we could support what each other was doing because we understood it. And to this day, that's kind of what I do. I'm now first getting myself up to speed on the social media part of it because I know that's an important piece and I never really did it before, but I'm doing it now. And it's a learning curve, just like everything else.
Yeah. Yeah. And with having AI now too, you can literally ask it anything, and the wealth of knowledge it spits right back out at you is pretty great.
Yeah, it's mind-boggling, actually.
It really is. I mean, the amount of access to information we have in 30 seconds is wild. It would have been nice.
It is wild.
Yeah.
It is wild. And I've asked AI questions and I notice it's formulating its answers before I finish writing the question.
Oh yeah. Yeah. And then there's like different sets to it. So you can have like AI self-correct itself and build out these models, or you can just use it. Some people even use it as like a little therapist, which is crazy.
Right. Well, it has its limitations. I'm not going to say it's perfected yet. You have to double check on the things that it tells you. Sometimes it's wrong. Sometimes it makes mistakes. It depends on what it sweeps through in the internet and what it collects on the way to your answer. Because there is a lot of false information out on the internet. And it unfortunately collects that information as well. So you have to vet what it tells you. And, I'm getting good at that, right?
Yeah. So, for other private practice owners considering a highly specialized niche or a less invasive treatment model like yours, what advice would you give them about building a successful practice?
Well, I think what you have to learn to do is provide the highest level of care that you possibly can. In my mind, because it's my experience, functional and regenerative medicine do that. It provides us with the template to help the most difficult patients because we're way past just treating symptoms. We're beyond trying to figure out what's the best drug or what's the best way to inject or what's the best surgery when everything else fails. We have a template for healthcare and healing. And I'm stressing the word healing because managing patients is what we do in the system. Healing them is what I've been able to do outside the system through these two paradigms. And I think what I would love to see medicine embrace is the healing paradigms that doctors are using outside the system. And it's not just functional and regenerative. That's my baby. There's longevity medicine, there's anti-aging medicine, there's lifestyle medicine. They're all part of the same paradigm shift to move more toward healing and health. And I don't know when that's going to happen, but I do know doctors are the driving force because the system is killing them. And in looking for better ways, they find ways to heal themselves from the stress and the burnout and the overwhelm that they've suffered, all through these years. And, that's gratifying to me to hear these stories. And I authored a chapter in a book that involves 16 doctors telling their story and their history about how they went from stress and burnout to where they are now. And that kind of book needs to circulate more in the physician community. It's called White Coats, Courageous Hearts. And I think that's a great place for a lot of doctors to start. Just read through it, see what's possible. It's doctors from all different specialties. We need to communicate more with each other, and we must change the culture in medicine because doctors are afraid to admit that they're suffering because they get ridiculed for being too weak or too soft or, not strong enough to deal with things. And that's not reality. We're all human. We're not superhuman. We're not beyond the things that stress anybody. And nobody can work with these demands, long term. It's going to take you down.
Yeah.
And I think this is part of why the system is failing.
Where can if any doctors are looking to buy that book, do you know where they can purchase it from?
Yeah, it's on Amazon, I'm sure. White Coats, Courageous Hearts. It was put together by Kim Downey,
Okay.
who's the number one physician advocate in the country. She's an amazing human being, and she's fighting hard for doctors. Yeah.
Shifting gears here a little bit, how has technology played a role in the growth and success of your practice, both in terms of clinical procedures and operational efficiency?
Well, on the technology side, there's no question that it's been the greatest boom to regenerative medicine.
Yeah.
Once we figured out all the different proteins and peptides that are needed for the human body to heal itself and learned the extraction techniques so that we can actually manifest something that we can put into the body that would signal the immune system and drive it to heal. This is the biggest amazing part of the technology that we're dealing with. Understanding how nutrients affect each part of the body, understanding how nutrients interact with drugs. It's not just what's reported. We see it in biochemical studies. All of that part of it is amazing. On the other side of the coin, the informational part of AI, it has its pluses. It definitely does. There are things that, arrive in your office and you're putting together the information that you have, and it doesn't always make sense, not because it's not nonsensical. It doesn't make sense because you may never have seen these combinations of factors before. And AI can help put a lot of these things together and make sense of it because it's able to go out into the ozone, pull all the different information and research articles and give some suggestions. And a lot of them are really right on. And, I can't say I haven't learned from AI. What I would like AI to be a little bit better at is vetting what it tells you.
Yeah.
Which is why when information comes in, I'll then do my own research on it. But it's a great starting point. It's an amazing starting point. And it does have suggestions on how to present what I do to the public so that they listen. Because, everybody's bombarded by information now. People go on social media, there's 10,000 things to look at. So you never know.
always, what's your vision for the future of chronic pain treatment? Do you see further advancements in non-surgical options? And how do you envision technology, particularly AI, shaping the patient care and access to specialized treatments?
Well, I think that the future of care is definitely going to improve as we learn more and more about what the human body requires for healing. There was just a study done in Stanford on an enzyme called 15-PGDH, and 15-PGDH is an enzyme that shows up in every single arthritic joint, and it causes degradation of the joint. We used to believe cartilage couldn't be healed. Now, when they use blockers to stop that enzyme, it's been done in mice and a few human beings so far. Cartilage regenerates. We were always told cartilage can't regenerate. So we're finding more and more information about this. And, the AI part of this is putting together systems to figure out more precise ways to understand the human body. I see the future of medicine as a great marriage of the human mind and AI technology. And I think that's the way it's going to go. Minimizing the time involved in documentation and all the laborious things that come with a medical practice. It's a great help. And it gives us more time to focus on patient care, which is what we need.
Great. So I know when we had first met before the podcast, you had shared a very beautiful story with me. Would you like to share that here? Is there any other stories you'd like that you can show people how you've impacted your patients' lives positively?
Which story did I tell you? Because I have so many stories.
You shared the story about this guy that was overweight.
Okay, I know what you're talking about. So I had a patient who came to me with severe neuropathy, painful neuropathy, numbness, tingling, pain, hypersensitivity. He was 350 pounds. He had been to lots and lots of doctors. And through my workup, we discovered that he was diabetic. We discovered that he also had an alcohol problem. And I sent him to take care of all of those things. And then he came back and I worked with him over the course of about a year. He went from 350 pounds down to about 190. And following my protocol, we got his neuropathy to no longer be painful. I had said to him, it's really important that you begin to move your body. And I want you to go work out on a bike. And I did the same thing, 60 seconds, 2 minutes, 3 minutes. He joined the health club. And in the process of going to the health club on a regular basis, he met a woman and he came into my office and he said, Doc, I met a woman. She's so nice. I said, oh, isn't that wonderful? He goes, yeah, I'd love to ask her out. He says, but I'll be honest, I haven't had a girlfriend since I'm in high school. I don't even know how to talk to women. So I'm afraid to ask her out. I said, why? He goes, because she'll probably say no. And I said, well, if you don't ask, you already got to know. So why don't you ask? You never know. So he asks her and she agrees. And they go out and they begin to date. And little by little, it turns into a romance. And he was always saying to me, oh, thanks for you. You did so many things. You even got me a girlfriend. They eventually got married and they moved to Florida. And, at that point in time, he still had some numbness in his feet, but he had no more pain and he was functional. He was able to do what he wanted. And it was just the most beautiful thing to maintain that friendship with him after he moved away because we stayed in touch by email. He kept me apprised of all the things that were going on in his life, how I had turned things around for him. And thanks to me, he had a wife and he had a life. And it wasn't just about his foot anymore. It was about a total transformation for him. Those are the kind of patients that make me so thrilled to be doing what I'm doing. You turn lives around, you create dynamics for them to have what they've never been able to achieve before. I'm not saying all of my patients had that kind of experience, but you do change lives. You change lives in dramatic ways. And it's why I love what I do.
Well, Dr. Kornfeld, I really appreciate this incredible conversation we've had. And for our listeners, especially those, experiencing chronic foot pain or just practices looking to understand, specialized models, where can they learn more about you or connect with you?
So they can go to my website, which is drrobertkornfeld.com. I have two offices, one in New York City, one in Long Island. And I'm also now affiliated with a personal injury and wellness center down in Fort Lauderdale, Florida. And they can look at continuumcenters.com for the information there. And I'd be happy to speak with anybody that wants to learn more about what I do.
Well, thank you again. This has been great, and we love how you're trying to do your part in impacting the world in a positive way. And we'll catch you next time on Beyond the Clinic Walls.
Thank you so much, Roby. Pleasure to be here.
All right.